Hello, my name is Dr. Fahim Khan. I am a consultant rheumatologist at the UPMC Even Hospital in Kilkenny, Ireland, and I want to talk to you about the pain relief therapy with Scrambler therapy or Calmare therapy. So, Scrambler therapy involves treating pain without the use of medication, drugs, etc. So, Scrambler therapy has been in use for the last 10 to 15 years, and I've been using Scrambler therapy for over 12 years in my clinic at the Even Hospital, Kilkenny in Ireland. So what is Scrambler therapy or Calmare therapy? Calmare therapy is used by the Calmare therapy device, which is an FDA approved device which actually transmits pain-free impulses to the body where pain impulses are being perceived. So in other words, when you have pain in your body, most importantly like a nerve pain, and these impulses are transmitted through your body to the brain, the electrodes from the Calmare therapy device would actually stop these pain impulses and would actually replace it by pain-free impulses. That's how it works. So Calmare therapy involves a total of minimum 10 sessions. So normally 10 sessions are given. However, some patient may need a few booster sessions, maybe 2 or 4 if there is a need for it. So Calmare therapy involves placing electrodes away from the site of the pain. For example, if there is a CRPS or complex regional pain syndrome, for example, affecting your arm, hand, then Calmare therapy electrodes are placed away where the pain impulses of CRPS or the nerve impulses are being stopped, and the new pain-free impulses are transmitted through the same nerve. They travel to the brain, blocking your existing pain impulse. So that's how it works. So there are no known side effects with this treatment, and when the treatment is on, there's no pain felt during the treatment, so totally pain-free treatment. If you look at up to 80 to 90% of patients do very well. So most of the patients, up to 90% of patients, are pain-free after the completion of the treatment. As you know, for conditions like CRPS or complex regional pain syndrome, it's mostly drugs, very serious medications are used, and most of the time these medications do not help to relieve the pain. So if you look at most of the trials using Calmare therapy for condition like neuropathic pain or nerve pain, like for example CRPS, most of the patients, they were enrolled at the study with a pain score of 8 out of 10. And after 2 to 3 weeks, their pain scores was relieved to 4 to 5 out of 10. So there is certainly improvement, and we see improvement normally after finishing the treatment, which is 2 weeks of treatment. That is every day, Monday to Friday, one session of Calmare therapy is given, which is roughly 45 minutes. And treatment is finished after 10 sessions, which is 2 weeks time. And then we see slow improvement in pain scores, which we wait till a few months before, if somebody or some of the patient may need a few top-up Calmare therapy session, which I mentioned earlier. They may need up to maybe 2 to 4 sessions if required, and that depends upon their pain scores. For example, if the pain scores goes over 7 to 8 out of 10, then we can certainly give them a few booster sessions. But most of the patients, they do very well after completing the 10 sessions, and 90% of patients are pain-free according to most of the centers which are using Calmare therapy device for the treatment of pain relief. So conditions that are treated successfully with the Calmare therapy would be nerve pain condition, neuropathic pain like CRPS, shingles pains, diabetic peripheral neuropathy, trigeminal neuralgias, chemotherapy-induced peripheral neuropathies, lumbar radiculopathy or trapped nerve pain, lower back pain, neck pain, other conditions like fibromyalgia, myofascial pain syndrome, phantom leg syndrome or phantom pain syndrome. These are the most important conditions which show very good result, and apart from that, conditions like cancer pain, oncological pain. So Calmare therapy is relatively new. I've been using it for 10 to 12 years, and I've personally seen very good results with this treatment. So if you guys want to know about Calmare therapy, please log on to my website, which is www.arthritisandpainclinic.com. Or you can look at Calmare therapy by Dr. Fahim Khan, Ireland. I have information on my website about Calmare therapy, which is FDA approved treatment, FDA approved device for the treatment of pain condition like nerve pain, oncological pain, etc. So it is also cleared by European treatment for pain relief, but most importantly, this is the FDA approved device and clear device which is used to treat pain relief. So it has trials, studies, and we use it for pain relief condition. As a rheumatologist, I use Calmare therapy apart from pain disorders for condition like fibromyalgia, or there's a variant of pain condition called myofascial pain syndrome, which is mostly pain affecting upper back, neck and upper back muscles. And we use it as part of other modalities of treatment for myofascial pain syndrome. So if you guys want to get in touch with us, we would need a letter from your doctor, your GP, primary care physician, or your neurologist or pain specialist confirming the diagnosis and a list of your medications you're taking. Some of the medication like Neurontin or pregabalin, for example, gabapentin, which is named for Neurontin, Lyrica, which is pregabalin. Patient would need to be weaned off these drugs before we start them on Calmare therapy. And there's some contraindication, like for example, patient with pacemakers, we don't have any studies. So Calmare therapy can be used, but I think it's better to avoid it for the time being. Similarly, we don't use Calmare therapy during pregnancy. We don't place electrodes, particularly on the scalp in somebody who has a background history of epilepsy. However, Calmare therapy electrodes can be placed for condition like trigeminal neuralgia. We can place the electrodes on the face and the forehead for condition like ophthalmic herpes zoster nerve pain. So it's a new treatment, relatively new treatment with excellent results and with no known side effects. And most of the patients, up to 90% of patients, were successfully treated with Calmare therapy. They are free of all their medications and they are free of all the side effects from the medication they are taking, which unfortunately these medications do not work successfully for condition like nerve pain, like CRPS, etc. So if you want to get in touch with us, you can always contact me by my email or office telephone number. The email for Calmare therapy is rheumatologyclinics@gmail.com. rheumatologyclinics@gmail.com. rheumatologiclinics@gmail.com. Or you can contact us at my office telephone number. The international code for Ireland is +353 followed by 5677211726. Or you can log on to my website. All the information to contact us is available there. So if you need any further information, please get in touch with us. Thank you so much and take care. Bye-bye.